I'm Dr. Rita McGuire. I'm the Chief Medical Officer for Wakanna, as well as one of the co-founders. I am also a divorced mom, and I have 3 amazing children. As you can see there in the slide, Jacob, who is my oldest, is 29. He's right in the middle there. And then to your right is my middle child, Joshua, who's 24. And then my baby girl, Hannah, who is 22 years old. And yes, I'm still a practicing physician. I've been practicing OB-GYN for the last 30 years. So yes, I'm still doing hysterectomies and C-sections and delivering babies, as well as I've transitioned a lot of my gynecological procedures in the cosmetic field of doing tummy tucks and liposuctions. And so I'm excited to let you know that last May, the governor of Illinois asked me to testify for the taxation and legalization of adult use cannabis. So I've been in the cannabis space for the last 3 years. Never thought that I would be in the cannabis space as an obstetrician gynecologist, but truly I'm an advocate for this plant. I've been using CBD products in my office for the last 3 years and have seen so many incredible testimonies from reducing pain, anxiety, inflammation, depression, which we're going to talk about tonight. So it's just been an honor to really engage with such a holistic and natural and organic way of healing in my practice. So I want to dedicate this webinar to my sorority sister. I am a member of Alpha Kappa Alpha sorority, and you see my sorority sister in the middle. Her name is Rita Montgomery, rest her soul. And she suffered from severe depression. Her depression was actually triggered or brought on by a divorce. You know, we all sometimes are just one step away from a depressive episode. And unfortunately, the physicians just couldn't get the medications situated right in her system. And unfortunately, my sorority sister took her life. So I dedicate this webinar on depression to my sorority sister, Rita Montgomery. So let's talk about cannabis, okay? That's why you're all here this evening, to understand how this plant can help with symptoms of depression. And so when we look at the plant, it's really important to understand that the cannabis plant has 2 species. So it's 2 species with 1 family, with many strains within each, but it's important to understand that 1 species, which is the marijuana species that many of us on the webinar have heard or maybe used before in the past, but the marijuana species has a high level of a compound called THC. And THC is an abbreviation for delta-9 tetrahydrocannabinol, and that's the compound that the plant produces that gives you the high. Marijuana also has CBD, which is an abbreviation for cannabidiol. And that's the part of the plant that does not have the psychoactive component or the high. The other species that we're going to concentrate on tonight is the hemp species. The hemp species contains a high level of CBD and a very trace amount of THC. So hemp, which is the non-psychoactive part of the cannabis plant, is the part of the plant that we're going to concentrate on this evening. Now, we talk about the fact that this plant has over 100 different cannabinoids. So not only does it have CBD and THC, but it has other cannabinoids that we find in full spectrum products. And we'll talk about our full spectrum products here at Wakanna, but it's important to know that when you put all of these compounds together synergistically, it makes a very profound effect on a cellular level, which means we get a lot of great results when we take full spectrum products. But as you can see in this health wheel or cannabinoid wheel, CBD, cannabidiol, is the hero. Why? Because you can see CBD has a very long list of medicinal properties. CBD not only is an antibacterial, but CBD helps to inhibit cancer cell growth. It's neuroprotective. That means it helps with all sorts of neuroprotective or neurodegenerative conditions that the brain can have, be it Alzheimer's, dementia, strokes, depression that we're going to talk about tonight. CBD also promotes bone growth. It reduces seizures and convulsions. In fact, that's when we really saw CBD mainstream. It was mainstream in like 2014 when a little girl by the name of Charlotte Fiji, she has something called Dravet syndrome. That's a syndrome where children have between 300 to 500 seizures a week. And it wasn't until this little girl's parents introduced her to CBD, Charlotte went from having 300 seizures a week to 3, hence the strain Charlotte's Web. CBD also reduces blood sugar levels in diabetics. It's found to reduce the function in the immune system. So those who have lupus, fibromyalgia, sarcoidosis, scleroderma, all of those autoimmune diseases are improved with CBD. CBD reduces inflammation. It reduces the risk of arterial blockage and coronary artery disease. It also reduces small intestinal contractions. It helps with nausea and vomiting, really important in those who are undergoing chemotherapy, even my pregnant patients who have morning sickness. CBD relieves pain. It relieves anxiety and depression. It slows bacterial growth. CBD suppresses muscle spasms. In fact, UC San Diego is now doing a huge study on CBD and multiple sclerosis. CBD is tranquilizing. It also treats a lot of skin disorders and conditions like psoriasis and eczema and acne. And CBD is a vasorelaxant, so it helps to dilate vessels in those who have high blood pressure. So you can see that the other cannabinoids that you see in this health wheel, yes, they have medicinal properties, but it's really the CBD that gives you the health without the high. Again, CBD is the most common compound found in the hemp plant. And it can be used, and I've used it in my practice for 3 years now in conjunction with traditional pharmaceutical medicine. So what makes CBD, which is coming from that hemp species, legal? Well, in 2018, President Trump signed a farm bill. As you know, cannabis, marijuana, on a federal level is a Schedule I drug. But in 2018, President Trump descheduled hemp. So no longer is hemp a Schedule I drug. In fact, hemp and CBD and all the components that are coming from the hemp species is legal in all 50 states on a federal level. So that's what makes CBD extracted from the hemp plant legal. So how does CBD work? How do all of these amazing compounds that are coming from the cannabis plant work in our body? Well, it is a real science. In fact, this system called the human endocannabinoid system, yeah, it's a mouthful, right? This system was discovered when I was in medical school. I'm dating myself right now. But I attended probably one of the most conservative medical schools in Detroit, Michigan, Wayne State School of Medicine. And in the early 1990s, this system was discovered. And what they found was that every single vertebrae, every single human being, everybody on this webinar has an endocannabinoid system that's looking for what, you name it. Yeah, it's looking for cannabis. It's looking for all of the compounds that the cannabis plant produces to put our body in balance or homeostasis. So this system has receptors in every single organ and gland in our body that's looking for cannabis, that's looking for CBD, that's looking for THC, that's looking for CBN to connect with those receptors to keep our body in balance, to decrease anxiety, to decrease depression, to decrease pain and inflammation, to help to reduce blood sugar levels. So this system is how these products work. So let's talk about some statistics on depression, because it is a very, very common psychiatric illness. In fact, depression affects 5 to 30% of the population. And according to a study that was done in 2017, almost 13% of Americans aged 12 and older take an antidepressant drug. In fact, they found that antidepressant use has increased from about 65% between 1999 and 2014. It's also known that women are more likely than men to take medication for depression. So 16.5% compared to 9% of males take antidepressants. There are different types of depression. We see something called seasonal affective depression, right? Some of us have that on days and days and days where we don't see any sun. There's postpartum depression that I deal with a lot with my patients. After having a baby, the hormonal fluctuation can cause depression. There's depression in children. There's major depression. There's persistent depressive disorders. There's bipolar disorders. There's psychotic depression. And there's even depression that can be caused from our menstrual cycle. So premenstrual dysphoric disorder. And then there's situational depression. You know, many of us on the webinar, including myself, has gone through some sort of depression due to a situation that has occurred in our life. So the causes of depression, well, we're not quite sure what causes depression, but there's a theory that there's an alteration in not only the structure of the brain, but the chemical function that has occurred. We know that there are billions and billions of these little neurons that communicate with each other in our brain. But the real theory that is been proven is that there are levels of hormones, serotonin specifically, that is linked to depression. So low levels of serotonin, that is kind of our mood chemical in our brain, is thought to be decreased. And there's also that stress and depression that comes that can be triggered even when we lose someone very close to us. So feeling down, feeling sad, feeling upset is normal. We all go through that at one point in our life. But what's concerning is when you're feeling down and sad and upset for several weeks on end. This is a concern. Some of the physical symptoms and some of the behavioral changes that we see that are caused by depression include, you know, decreased energy, chronic fatigue, just feeling sluggish. Why? Because many times when we're depressed, we can't sleep. We have insomnia. When we can't sleep and have insomnia, the next day, it's difficult to concentrate because we're fatigued. A lot of times when we're depressed, we'll get muscle aches and spasms, cramps, even GI upset, nausea, vomiting. There's even changes in appetite and our weight. Some people, when they're depressed, they overeat or emotionally eat. And some people, when they're depressed, they don't eat at all. So there is a lot of physical symptoms that come with depression. And there's emotional symptoms as well. There's something called anhedonia. Anhedonia is when you lose interest in things that you used to find pleasure. Maybe you were a skater. Maybe you love to line dance. You just lost all interest in activities and hobbies. There's a persistent feeling of sadness and anxiety or emptiness. There's feelings of hopelessness and being very pessimistic. Some emotional symptoms are anger, irritability or restlessness, feeling guilty or experiencing feelings of worthlessness or helplessness, and then severe depression, thoughts of death or suicide. So I put a suicide hotline, 800 suicide, real important that if you ever feel any thoughts of hurting yourself or killing yourself, that you get immediate treatment. This is really fascinating. This is a slide of a PET scan of the brain showing the different activity levels in someone who is depressed. The brain activity is not very active on the left versus someone who is not depressed, where the brain activity is very active. Now, depression and anxiety truly do go hand in hand. There are some anxiety disorders that I want to go over. Panic disorder. Panic disorder is awful. You know, my middle child had panic disorder one time while he was in college and thought he was actually having a heart attack. That's a scary thing. Panic disorders, you feel very fearful. You may have sweating, chest pain, palpitations. A social anxiety disorder is more of an anxiety disorder when you feel a little overwhelmed about going out in social situations. And then there's phobia, you know, intense fear of flying or maybe heights. And then generalized anxiety disorder, where you feel just excessively worried and tense for no reason at all. So some of the physical symptoms that those who have these anxiety disorders are very much like those physical symptoms of those who have depression. You know, feeling fatigued. Why? Because when you are anxious, when you are depressed, you can't sleep. And then when you can't sleep, it's hard to concentrate the next day. You may have a lot of muscle tension. I know sometimes when I'm anxious, I get a lot of tension in my lower back. You may have a racing heart rate. You may grind your teeth at night. And again, those difficulties in staying asleep and falling asleep as well. Some emotional symptoms that those who have anxiety have, they're restless, they're irritable, they feel on edge, they have panic, they have difficulty controlling their worry, they're very fearful. All of these things I know a lot of people are going through right now because of the coronavirus, right? Everyone is anxious, they're fearful. They, you know, they don't want to do the things or be around a lot of people. So it's causing a lot of anxiety in our community. There's no really single test to diagnose depression and anxiety. Typically, when you go to your physician and you voice your concern, we do a physical exam. There may be some screening tests that are done to rule out suicidal ideations. We may check some blood levels just to ensure that you don't have hypo or hyperthyroidism, your vitamin B12 levels, and if you're a woman, of course, those hormonal levels to ensure that you're not peri or postmenopausal. You also may get referred to a mental health expert like a psychiatrist or a psychologist. But let's talk about medications, because that is the next thing that will happen if you go to your healthcare provider and you complain of depressive or anxiety symptoms. And some of the medications that we use as antidepressants are listed here. Some of you on the line may be on some of these medications. Some of you may know folks that are on these medications, but there's two main classes of antidepressants. One is a selective serotonin reuptake inhibitors. Those are drugs like Prozac, Zoloft, Lexapro, Paxil, Celexa. And then there's another class of drugs called serotonin norepinephrine reuptake inhibitors. Those are Effixor and Cymbalta. I'm sure you've seen lots and lots of commercials about a lot of these drugs. Each one of these drugs carries some benefits and risks. Many drugs that we use for anxiety include Prozac, Zoloft, and benzodiazepines like Xanax. Many of you've heard of Xanax. Now, Xanax is a really, really concerning drug because long-term use of Xanax, research and studies have shown that it causes dementia. And then there are mood stabilizers that you may be placed on, like lithium or Depakote. And these drugs also stabilize your mood if antidepressants don't work. So let's talk about some of the side effects. You know, when you're placed on an antidepressant medication, what's interesting is that those medications take between 2 to 6 weeks to get a steady state in your system, to really get into your bloodstream. So that's why typically if you're placed on one of those medications, we don't have you come back as an outpatient in 4 weeks, because we know it takes a nice amount of time for that medication to even get into the bloodstream or a steady state in the bloodstream. Along with that are these side effects, and side effects from the antidepressants are why many patients stop taking their medications. Side effects include sexual dysfunction, so a decreased sex drive or no sex drive at all. Insomnia, can you imagine being depressed and can't sleep and a medication causing even worse insomnia? So inability to get to sleep or staying asleep. Dry mouth is another big one. Your mouth feels very dry on some of these drugs. You can't produce the same amount of saliva as usual. And then there's dizziness, headaches, mild to moderate nausea, sleepiness, fatigue, weight gain, constipation, and diarrhea. So these are some of the side effects that so many patients don't enjoy working through when they're placed on these medications. And then there's therapy. There's cognitive behavioral therapy, where you will learn how to adjust your thoughts and behaviors and reactions so you're more rational. There's interpersonal therapy. This focuses on how to communicate more effectively and express yourself. And then there's problem-solving therapy. This therapy focuses on using coping skills and managing symptoms. And then there's holistic treatment for depression and anxiety. Exercise, I can't stress enough, reduces stress and anxiety and depression. Your diet, you know, diet that is full of processed foods and fried foods don't improve symptoms of depression and anxiety either. There's light therapy. There's St. John warts. There's pets. We see a lot of folks that have companion pets that help to improve their mood. It could be a dog, it could be a cat, it could be a bird. And then there's something called vagus nerve stimulation and electroconvulsive therapy, as well as transcranial magnetic stimulation. And then, of course, what we're going to talk about tonight, cannabis, CBD for depression and anxiety. So let's look at how CBD affects depression. Well, we talked about that endocannabinoid system, that system that is looking for cannabis. Well, the same thing happens with depression. We talked about in depression, levels of serotonin, which help with sleep, appetite, mood, and inhibits pain, and the receptor for dopamine that motivates your behavior. These levels in the brain are found to be low in people who have depression and anxiety. So what happens is that CBD comes in and hooks onto those receptors so that there can be a release of not only your natural serotonin to be effective and your natural dopamine levels to be effective, but it helps to increase those levels of serotonin and dopamine. Now, you may say, Dr. Rita, That's the same thing that antidepressant drugs do, like Lexapro and Zoloft and Prozac. Exactly right, without the side effects. And what you'll find in a study that I'm going to show you very soon on the next slide or so is that CBD's onset of action and steady state reaction is not 2 to 6 weeks, but it's 30 minutes. So you have a holistic option with CBD, not only to work faster in relieving symptoms of depression and anxiety, but with less side effects. So again, we're going to go over a couple of studies for those who may be healthcare professionals on the line on the research that shows that CBD absolutely can benefit people who are suffering from depression in several ways. You know, CBD is an anti-anxiolytic, which means it helps to lower anxiety. It does improve the cognitive impairment. It helps us sleep so we're not irritable, we're not fatigued, and CBD increases libido, that sex drive. And it helps with inflammation and pain, because we talked about many times when those are depressed or anxious, sometimes we get pain in different parts of our body. So there have been many, many studies on CBD. Many of the studies in the United States have been done on animals. Why? Because CBD has just been legally released from being a Schedule I drug in 2018. So now you're going to see many institutions doing a lot of studies and research on CBD on humans. But what we do know are that there are studies that show, like in this study, that CBD induces a rapid release of serotonin and dopamine levels, so that those who suffer from depression will get relief within 30 minutes. So this study is shown here. This study was done on male rodents, but it absolutely showed that the benefits of using CBD versus an antidepressant is that CBD not only works faster, but has less side effects. There's another study here that shows CBD can also be used in disorders like schizophrenia. So it acts as an antipsychotic. It helps, again, with different proteins and hormones in the brain. And this study actually shows that there is inflammatory processes that occur in the brain that causes a lot of folks to have those disorders like schizophrenia, and how CBD can come in and decrease the inflammation. So when we look at mood disorders and depression, again, the endocannabinoid system not only is a great system that helps to put the body in balance, but to improve and increase serotonin levels, and to also act as an anti-stress and antidepressant. Even in PTSD, post-traumatic stress disorder is not only found in veterans. Post-traumatic stress disorder can be found in folks that have undergone a traumatic, stressful event in their life. CBD has been shown to decrease the remembrance and to come in and to extinguish those memories that post-traumatic stress disorder sufferers have. This is another study that shows the therapeutic potential of CBD being a great non-psychoactive component like THC is in helping to relieve symptoms of depression and anxiety. So there are different ways that you can consume CBD, okay? There is an oral application where you can put the CBD oil underneath your tongue. There's sprays, there's capsules. You can infuse your food, your beverages with CBD, your smoothies. And then there's edibles. There's CBD infused gummies. There's CBD tea and coffee. There's CBD cookies. There's vapes. They're vape oil cartridges that are infused with CBD, offers instant relief. I love vaping for conditions like depression and anxiety, because once you vape, The onset of action is within 1 to 5 minutes. And then there's topicals, because we understand that many folks that suffer from depression and anxiety will have pain in their back, pain in their neck. You know, they're just so tense that a topical CBD product is very, very effective. So let's transition into our company, Wakanna, and a lot of our products that can be very beneficial for those who are on the line that suffer from anxiety and depression, or those loved ones that you may know that suffer from anxiety and depression. The name of our company, again, is Wakanna, and we just launched our business last April of 2019, and we were brought into existence through the synergistic efforts and shared foundational values of 4 African-American women. And the 4 of us truly believe that health, wealth, legacy, and freedom are gifts that belong to all people. And this is our leadership very quickly. Our CEO is Melissa Boston. Our president is Dr. Patricia Van Pelt. Our senior VP of sales is Phyllis Nash. And I am the chief medical officer. These are our 4 co-founders. These statements have not been approved by the FDA. Our products should not be used to treat, cure, prevent, or diagnose your condition. If you're nursing, pregnant, on medication, or under a doctor's care, always consult with your physician prior to consuming any nutraceutical or nutritional supplements. Well, this is our product line. Our product line has 2 different products. We have what we call a power line. That is our full spectrum product that gives you all of the cannabinoids that we saw on that health wheel, with the legal limit of THC, which is 0.3% or less. Now remember, our CBD products are extracted from the hemp species, so you will not get high. That's really important that you understand that hemp gives you all the medicinal properties and benefits without the high, like marijuana. And then we have our pure line. Our pure line is on the right side of the screen. That is a broad spectrum line that contains less than 0.0% THC. That is a line for folks who have random drug screens at their job. That's our pure line. Our products are very unique. Our products are like no other products on the marketplace. Here at Wakanna, we provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, and our products are Farm Bill compliant. Again, the 2018 Farm Bill legalizes hemp in all 50 states on a federal level. Hemp is descheduled, no longer is it a Schedule 1 drug, and to be compliant with this Farm Bill, it has to be extracted from the hemp species, which means it can only contain 0.3% or less of THC. Now, that 0.3% or less is such a minute amount of THC. In addition to it's coming from the hemp species, you will not feel or get a high. So let's go through some of our products that I would recommend for those folks who are on the line, or maybe folks that you know that suffer from anxiety and or depression. You may be on the line and you may already be on an antidepressant or an anti-anxiolytic or even a mood stabilizer. It is okay. You want to speak with your physician. You want to let your physician know that you want to start taking CBD because of all of the studies and research. In fact, there are 22,000 peer review articles about CBD, that you want to start taking CBD because CBD has been shown to improve those symptoms of folks who have depression and anxiety as well. So our first product is our Hemp MD. This is a more therapeutic product, meaning it's our more potent product. It's 750 milligrams of CBD, excuse me. This is a product for someone who has pretty severe depression, severe anxiety, and is really looking for a holistic, organic option for their depression and anxiety. Maybe someone who wants to come off of some of those medications. Remember, we talked about Xanax. Xanax is one of those medications we use a lot for anxiety, but long-term use of Xanax, we have shown, causes dementia. So this is a tincture, which means you place it underneath the tongue, you hold it for 60 seconds, 3 drops in the morning, 3 drops in the evening is a great starting dose on this product. And again, what I love about CBD in the tincture form is that it works within 15 to 20 minutes. So you're not waiting for an antidepressant or an anti-anxiolytic 2 to 6 weeks to kick in. Our next product is our Hempranium 500. It's a 500 milligram CBD product, but it has a proprietary formulation that's only unique to Wakanna that infuses our CBD oil with black seed, turmeric, and peppermint. So what does that do? These are 3 essential organic essential oils that increase and enhance the CBD properties. Again, this is a tincture. You place it underneath your tongue twice a day, 3 drops in the morning and 3 drops in the evening is a great starting dose. We even have a water-soluble product. I love this product because if you suffer from anxiety or depression, you can infuse this in your water, your juice, your smoothie, your oatmeal, whatever you're eating or drinking, you can simply infuse with our water-soluble product. And then we have a product that you can bake with, you can cook with, you can get the same benefits in reducing depression and anxiety by infusing your baked goods. This product is not flavored, so if you don't like turmeric or black seed or peppermint, you can use this product as a tincture by placing it under your tongue as well. So this is a slide that shows the proper way of using CBD, placing it under the tongue, holding it under the tongue for a minute before you swallow so that the CBD can be absorbed in the bloodstream. It's important not to drink or eat or smoke for at least 15, 20 minutes afterwards for optimal absorption. We also have gummies. We talked about edibles. We have infused gummies that you can use. I love using a gummy at night to help me sleep. So gummies take about 45 to 60 minutes to get into the bloodstream. So this is a great addition to a tincture or water-soluble product to use at night. So I highly recommend those 3 drops in the morning, 3 drops in the evening, and top it off with 1 gummy at night to really help you get into that rapid eye movement sleep, that restorative sleep, so that when you wake up, you feel refreshed and energized. These gummies actually help not only with sleep, but with pain and inflammation and libido. Because we talked about some of the side effects of these medications, one being a decrease in sex drive. So this is a great product. And then these next products that I want to really concentrate on give you pretty immediate relief. Vaping and smoking CBD, the onset of action is within 1 to 5 minutes. So let's say you have an acute panic attack, or you have an acute anxiety, or a social phobia. You get really, really anxious about something, right? Tomorrow I'm going to get on an airplane and fly to Albany, New York to speak to several groups about our products and our company, right? You best and believe I'm going to be vaping my CBD before I get on that plane just to reduce my anxiety about this coronavirus. So our CBD pre-roll joints, yes, is a CBD joint. It's not marijuana. It won't get you high. It has 163 milligrams of CBD and the 0.3% or less of THC in this joint. And all you need is 2 to 3 pulls on this joint. You don't need to smoke the entire joint. That's way too much CBD at one time, but 2 to 3 pulls will offer immediate relief for anxiety, depression, pain, or inability to sleep. And then our vape oil cartridge, the same thing. The onset of action is within 1 to 5 minutes. So if you need immediate relief, absolutely, you're going to have a vape oil cartridge or a CBD pre-roll on hand, along with your tinctures, your 3 drops in the morning, your 3 drops in the evening, that 1 gummy at night. That is the recipe that I highly recommend for each and every one of you that are on the line that suffers from anxiety or depression. And then we have our topical products for pain relief, because we talked about the fact that when many of us are anxious or depressed, we have back aches, neck, we have spasms and tightness all over our body. The CBD topical offers local relief to those areas. We have a 500 milligram product that we use for mild relief. We have a 200 milligram product that has, it is enhanced with more organic oils that provide moderate to severe relief. And then we have something called Dr. Rita's Rub, which is a liquid CBD topical relief that also helps with pain and inflammation. So we have 3 different topical products you can choose from. So let's transition into our peer products. Again, our peer products are for those who are on the webinar that may have random drops at work. This is a product for you if you suffer from depression or anxiety. It contains less than 0.0% of THC. This is a tincture, and it contains 300 milligrams of CBD. Again, 3 drops in the morning and 3 drops in the evening. Now, what makes our pure broad spectrum products unique? No other company has nanotechnology, which is a delivery system that increases the CBD's bioavailability to 98.7%. What that means is that this product can get to the cellular level more effectively, as well as we've enhanced this product with our turmeric, black seed, and peppermint. So it enhances the CBD benefits. We also have gummies in the pure form. Again, each gummy is 25 milligrams of CBD. This is a great gummy for children who may suffer from anxiety or depression. It's great for sleep. I take, again, a gummy every night, 45 to 60 minutes before I retire, to help to get into that rapid eye movement sleep. These gummies also help with libido, also helps with pain and inflammation. So the last slide talks about CBD and its side effects. One thing that you need to know is that the drug-drug interaction that I've studied over the last 3 years with CBD involves the way that it's metabolized. CBD is metabolized through our liver. So a lot of medications that have been found that could potentially have a drug-drug interaction is Coumadin. Coumadin or warfarin is a blood thinner. So those patients who are on Coumadin or warfarin, they need to have some additional INR checks with their physician. Doesn't mean you can't take CBD. It just means that your physician may have to check your blood levels a little bit more frequently. If you're on the line and you're on an antidepressant, or if you're on an anti-anxiolytic, or if you're on a mood stabilizer, I recommend that you take your medications as prescribed, and an hour later, you do your medications with your CBD. Some of the minor effects that CBD may give, and that's only if you take too much CBD initially. That's why I recommend to all of my patients, start low and start slow. Start with 3 drops in the morning and 3 drops in the evening. But some of the minor side effects that CBD may cause is diarrhea, fatigue, and some weight changes or appetite. So if you're interested in trying CBD for anxiety or depression, I really highly recommend that you contact the person that invited you on the line tonight. Get your questions answered, get on these products. Again, I recommend a combination of our products, that combination being that tincture or water soluble, along with the gummy at night. Highly recommend our gummies for sleep. And then a vape oil cartridge or a CBD pre-roll joint for those acute onsets of anxiety or depression. So I always open up the line at the end for questions. Let's see here. I'm going to stop sharing. We're going to see if we can take some questions. You can type your questions in the chat box there. But I do have one of our business partners, my business partner, Minister Mooney, who has a very powerful testimony about how these products have helped him. So I'm going to allow him to give his testimonies, and then we're going to take some questions. Minister Mooney, are you out there?
Yes, can you hear me?
I can hear you loud and clear.
Awesome. Wow, that was so powerful. Actually, wow, a lot of new information that you shared exposed to me for the very first time. One thing that I can say is that I never knew that I was actually dealing with anxiety. Even after years ago, I was in a car accident. And actually, not until I went to, a mental specialist, that I realized that I was dealing with depression. Not until I actually talked to somebody. And then, men like myself, sad to say, and a lot of people, we don't want to admit because we don't know. We don't want to admit that we go through things like that. So it wasn't until, say, for example, that I actually realized that I can deal with depression until that accident. And I was just actually following up because it was protocol, and it was suggested that I did take that protocol because of the accident. So I realized after the medical professional talked to me that I was dealing with forms of depression based off of what they shared and based off of what I shared with them. So fast forward, I didn't know that I was dealing with anxiety until actually I made contact with Wakanna's products, particularly the vape. I would get in front of the room, of course, being a minister, and share, just, doing our presentation or whatever, or speaking to a large public crowd. I just thought it was the Holy Spirit. But what actually happened when I started vaping, I tried it, was that anxiety started going away. I can find myself immediately smoking a vape or inhaling a vape, and then I would just have this calmness over me. So fast forward, just in everyday life, I work like crazy. And of course, because of the task that's on hand, I definitely come in contact with a whole lot of people, being a minister, helping a lot of people, and, people pouring into me as well as I pour into them. And then I find myself that even with my surrounding environment, it's a lot to take on. So I find that when I now use the pre-roll and just bring in that CBD, that I'm able to cope with everything that's around me. I take on a different perspective. And I think that's how you explain regarding the endocannabinoids or the CBD itself, the endocannabinoid system and the CBD itself. It just has a tendency to cause my emotions, my feelings, the way that I think to come to a calm. And I'm able to see through it clearly. And I don't react the way, and I'm a Leo, which is real bad, but I don't react the same. So, I would say I'm blessed to continue to learn more about what you've been sharing with us, Dr. Rita. And I'm blessed to now know where a lot of things come from and what I can do to cope with it. So thank you so much.
Well, thank you for that share, Minister Mooney. And you are just so right about, the stigma that still holds a lot of us back from seeking help when there's anxiety or depression that's going on. And so what we're seeing now, is a definite increase in suicide rates, just because folks don't feel comfortable in sharing the fact that they need help. And by understanding how CBD works in our body and the endocannabinoid system, and knowing that the same mechanism that antidepressants and anti-anxiolytics and mood stabilizers have on serotonin levels, without having the side effects, without having to wait 2 to 6 weeks for that medication to work, is just such an eye-opener for so many of my patients and other healthcare professionals. So thank you for that share. Yes.
One other thing, you know what, you just touched on something that I have to share with everybody on this line. It is so eye-opening that just by putting that post on my page of who's suffering from depression, it used to not be a cool thing to say that that's something that we're suffering from. But I'm actually in conversations and witnessing that people are now taking on the courage because they need help. So if you're on the line and you know of somebody that actually is, and maybe it's you, and the forms that Dr. Rita has shared and the symptoms of which depression can come in, please, no more being embarrassed. Go ahead and speak up and find yourself some help. Because we're here.
Absolutely. Thank you so much, Minister Mooney. I'm going to take a couple of questions. It's almost 9 o'clock. I do see a question in the Q&A area. And the question is, can you explain 200 milligrams versus 500 milligrams? Is 500 milligrams stronger? So in our product line, you will see in the tincture form a 750 milligram and a 500 milligram. That is the amount of CBD that's in the entire bottle. So yes, that 750 milligram product, the Hemp MD, is going to be more potent than the 500 milligram Hempranium product. What we do is that in our certification, because we have a certification where we really teach our business partners how to dose or microdose, each drop, if you took each drop in that bottle, each drop of the 500 milligram would be 1.67 milligrams. And why that's important to learn as you're dealing with our product line is that there are some folks that want to use our products that may be 250 and 300 pounds, right? And then you may have other folks that are children that you need to understand the dosing on the drop per milligram and their weight. So yes, that 750 milligram versus a 500 milligram versus a 300 milligram product. One is describing what the total amount is in the bottle. Each of our bottles is 15 mLs, and it helps you to calculate how many milligrams are in each drop. So I hope that helped and answered your question. Are there any other questions out there? Let's see if there's another one. My daughter was in a car accident and suffers from anxiety. I started her on CBD and it helps. She also takes it for back pain due to the accident as well. Thank you, Ms. Townsend. Yes, absolutely. Again, in those folks that suffer from anxiety and depression, it can come from, like I said, a stressful situation that happened in their life. It can cause PTSD. A bad accident can not only have a mental component, but a physical component that it leaves you with pain in the back and the neck. So absolutely, those topicals, you're going to want to add into that person's regimen along with a vape cartridge or a pre-roll CBD joint, and or our tinctures and our water soluble. So you want to make sure that you're addressing all the symptoms that that person could have due to their anxiety or depression. So glad that your daughter is doing well. Any other questions before we wrap it up? Great webinar. I want to thank each and every one of you for joining us. If you are a guest on the line, we want you to contact the person that invited you so that you can get your products ordered, you can get your questions answered, and we hope to see you next Wednesday. This same Zoom ID 375-679-941. We will post the topic for next week. You can also email me. You may want to suggest a topic that I discuss. My email is drritamac@yahoo.com. That's DR, then my first name, Rita, Rita, M as in Mary, A as in Apple, C as in cat, @yahoo.com. Have an amazing rest of your evening, and we'll see you next Wednesday.